Hi, I'm Dr. Jack Coiner, and I'm excited to be joining Chestnut Ridge Medical in Blowing Rock, North Carolina. I'll be bringing robotic hysterectomies to this area. That's a unique procedure that nobody's done here before. So with a robotic hysterectomy, we also do procedures with ovarian surgeries. One of the main reasons I enjoy using the robot for that is for fertility sparing, whereas historically we may have had to remove the entire ovary. Using robotic technology allows me to do micro-dissection, which allows me to more easily preserve ovarian function, so the patient's fertility desires are not affected as much by surgical corrections. My certification in MIGS is Minimally Invasive Gynecologic Surgery. So to have certification in MIGS, we had to turn in a case list of over 100 cases that we've done in a calendar year to the board. They reviewed it, and then if they approved your case list, you were allowed to sit for the examination to have the additional certification for minimally invasive gynecologic surgery, which I went through several years ago. The main reason I adapted my practice for robotic surgery is how quickly the patients are able to bounce back. Women lead busy lives. They're usually the primary caregiver for multiple people in their family, so downtime is something that they can't afford. And so by using this technology, we get them back on their feet faster, we get them exercising faster, we get them back to activities of daily life, which overall decreases the burden to both them and the family to have mom down and out.